Hi, I'm Dr. David Wang, and I am here with RPI. Very excited to be here. I am a specialist in physical medicine and rehabilitation, also known as physiatry, and I've been in practice since 2007, and fortunate enough to have been practicing regenerative medicine for that entire time, pretty much throughout my career. And to give you a little bit of background, I started my medical journey by attending the West Virginia School of Osteopathic Medicine. And I did an additional year as a teaching fellowship in osteopathic manual medicine. So I've always had an interest in the biomechanics of the structure of the body and how we can improve things, even just with the skill of our hands. And I was first introduced to prolotherapy in terms of my first regenerative medicine exposure. I believe as a third year medical student at the American Osteopathic Association annual conference. And then from there, it was kind of in the background of things. And it always seemed very osteopathic in the sense that with our osteopathic tenets, structure and function being interrelated, and that the body has a natural ability to heal itself, that regenerative therapies fit very, very nicely within that framework. And so then in my third out of fourth year of residency, I attended a conference on regenerative medicine. Then later, I think it was later that year, once I was in my fourth year and last year of residency, I went on my first prolotherapy service trip to Honduras, and that changed everything. And from that point on, I just kind of, drank the Kool-Aid, if you will, and I've attended now, I think, 33 service missions in Mexico and Honduras, Greece. And one of the things that I love about regenerative medicine is that it allows you to help the patient to heal kind of naturally, right? You're augmenting their own ability to heal. And so in my residency at Harvard Medical School, it's interesting because, oh wow, Harvard and everything like that, I tell you, it's a great place, but they teach you the basics well, but really in terms of the core of regenerative medicine, it was through organizations like RPI and others where you really pick up the nuances of how best to apply regenerative therapies. What are the specifics about the injection techniques? How do you apply diagnostic ultrasound specifically for that particular area? What is your proper differential diagnosis and all the exam findings that come with it? It's like this nice package all put together. And for me, I have been teaching some form of like physical skills since I was 16 in terms of my time in the martial arts, my time teaching osteopathic manipulative medicine. And the thing about my opportunity to teach in regenerative medicine, it's a similar sort of thing. It's a physical skill, how to control your needle when you're doing an injection, how to hold the ultrasound probe optimally so that you have full control. And so I think that I've been lucky enough that my background in teaching physical skills comes to play in how I teach these regenerative medicine techniques and diagnostic ultrasound techniques. And so I feel like I can bring a little bit of a unique perspective to that, along with all of the other amazing instructors who some of them are my best friends. Together I think that RPI has a very strong instructor core, along with some great information that we have to offer to everybody to basically help us all take better care of our patients.